According to the Ebola incident commander, Lieutenant Dr Aceng, the number of people who have died from the Ebola outbreak that was announced this week has risen from 11 to 19.
19 deaths, still 3 confirmed deaths, and 3 probable, 16 probable again.
While the number of confirmed cases has also risen from 11 to 15. 40 admissions have also been registered at the isolation center, of whom 11 are confirmed cases, while 18 are still suspected. But Chobe has expressed concern over the low contact tracing, with only 213 contacts traced so far since the outbreak. This, according to Chobe, raises fear that some contacts might be outside Mubende district.
Meaning that the community contacts have not all been listed, and which creates a challenge that we may actually have cases that emerge outside our confines.
In response, Minister of Health Dr Ruth Aceng has blamed the low contact tracing on poor surveillance by health officials within the district.
That the most important aspect of surveillance is contact tracing. So we are failed in that area. And all these partners here are here for contact tracing.
Whereas officials try to blame the poor surveillance on limited funds, the tough talking Aceng pointed out that this is not a good enough excuse.
Mubende has 30 vehicles here. So don't tell me about vehicles and money. Money can be paid tomorrow, but everybody is waiting for money. Now by the time money comes, many people will have died. That is not good.
Whereas she has assured all the health workers that resources will be availed to address the outbreak, Aceng warned that each and every shilling will be accounted for.
I want to understand where your resources are going. Because usually we end up with a lot of duplication. When I start asking again, because we also have Ebola accountability forum, we have epidemic accountability forum, don't forget that. Because when I invite you to that forum, I want you to tell me where you have put your money.
She also warned everyone involved in this effort to follow and adhere to the protocols that will be availed by her ministry to guide the response to the outbreak.
Sometimes we have handled Ebola and you find a certain partner wants to do it in a certain way, another one wants to do it in a certain way, then everybody wants to run back. My head is full of epidemics. I don't want confusion on the ground. We need to move smoothly.
Minister Aceng has also revealed that the country has already applied to the World Health Organization to provide it with Ebola vaccines.
Have we requested? Yes, we requested, and WHO responded. So we have to respond again to WHO and state our facts clearly. And we shall do that after having a good discussion with the Scientific Advisory Committee that will give advice and then we act.
Emergency vaccination. Honorable Minister, I want to tell you that the WHO has responded immediately we received your request. There's been discussion initiated within 24 hours and there will be one that should come up with a strong position on Monday. This is what we have already communicated to you yesterday of the preliminary discussions. Letter was shared yesterday with the Permanent Secretary. On Monday, we should be able to see how we proceed with the protocol.
Meanwhile, leaders in Kabale District and Fort Portal City are also stepping up measures to address any possible outbreak of Ebola. In Fort Portal City, the Ebola Task Force has written to the Health Ministry requesting for 906 million shillings to put in place the necessary items and resources that will be used.
We don't have most of the PPE in most of the facilities, and also it is part of what we are trying to solicit funds for on this particular committee that has been instituted by the RCC.
In Kabale District, the Emergency Task Force has directed the Kabale municipal authorities to ensure that all markets and other public places in the town have washing facilities.
Our social mobilization is going to concentrate, the community mobilization wants to concentrate much in the municipality because of its concentration of the population, the market, the park, and so on.
Joyce Nakato, NTV Weekend Edition.